So, if there are no obvious questions that you want to ask straight away, I thought I'd dive in with one that I got relatively recently. Was it recent? Yeah, via a personal message, which was, I've got a 9-year-old Jack Russell who suffers with anal gland problems and itchy rashes in his ears and on the tummy, constantly licks and bites his paws all the time. He's had the usual antibiotics and steroids, but it doesn't seem to be getting any better, and this person is thinking about changing vets. And is there anything else that we can do? So, hi Ange, hello. You're supposed to be working, aren't you? Anyway, so anal glands, skins, feet, they can be just a nightmare to deal with sometimes. And one of the things that I often see is that people want a quick fix for something that can be quite a difficult problem to solve. So I would put skins, I would put anal glands, I would put feet and ears. They're all part of the same problem. So essentially, the anal glands are outpouchings of the skin around the bottom. The ears are just part of the skin, and clearly, the paws are skin, and the tummy is as well. So we can lump them all under the same heading of itchy skins. Now, why might a skin be itchy? Well, there are lots and lots of different reasons, and generally you can break them down into sort of 4 or 5 main topics. You've got your parasitical infections, so you've got fleas, mites, anything that's kind of creepy crawly lives on the skin, or actually within the skin in cases of things like demodectic mange. You've got yeasts and bacteria, a few viral things I suppose, but they tend to cause other things other than irritation. And then we have our allergic skin diseases. So by allergic skin diseases, I'm including basically skin, things that would cause real severe inflammation immediately, but also maybe like an intolerance, so food intolerance or an intolerance to a particular pollen or particular epithelium, sheep epithelium or even cat epithelium, that sort of thing. So there are lots and lots of different things that can cause it, and the problem is that one thing can lead into another really, really quickly. So you can have a parasitical problem, which essentially can become become infected, and you get a bacterial problem, or you can get a bacterial infection, which then goes on to predispose the dog or the cat to parasitic issues. You can have allergic issues, which then become infected, which then cause parasitical issues. You can have infections which predispose dogs to allergies. So by the time we see them in the surgery, or by the time that you're really frustrated with it, it's usually a whole mix of factors in there. And yeah, sure, sometimes just changing the diet can help, and people will advocate for raw diets, people advocate for hypoallergenic diets or grain-free, and there's lots of different things. But what I would say is that one thing doesn't necessarily isn't a cure-all for every single animal out there, which is why these things can be so frustrating. Your friend's dog might have had a grain-free diet which has worked really, really well for it. You give it to your dog, doesn't make any difference. The vet's saying that you should be on a hypoallergenic diet, and the whole thing can be a real complicated muddle to sort out. So I tend to adopt a really stepwise approach to these things. You need to start stripping away the onion layers to get down to the root cause of what's at the bottom of all this. And it can be a long and involved process. And sometimes people want to short circuit that process and just get to, having a non-itchy dog or a non-itchy cat, which is fine. And there are certainly drugs that we can use to sort of paper over the cracks, I suppose, a little bit. And, the dreaded steroids is top of the list there, I suppose. I always say that if you ever see a dog on steroids and antibiotics, then everybody's run out of ideas at this point. That's the only thing that's going to work. So steroids to keep the inflammation at bay, antibiotics to keep the side effects of the steroids at bay. It's all a bit of a nightmare, really. So yeah, so steroids can help. You've got things like Apoquel, which work on a slightly different pathway to steroids, but same sort of effect, but don't have don't have the same side effects. Then there are injections as well that we can use to help reduce the predisposition of dogs to get itchy. So there are these sort of shortcuts we can use to get to a non-itchy dog, but ultimately, especially in younger dogs, it works out cheaper and better for the dog in the long run if we actually address the root cause. So if the dog is itchy because it's allergic to chicken or something like that, then much better to remove chicken from its diet than have it on lifelong steroids for the rest of its life. And whilst we're on the subject of food allergens, one of the reasons why we tend to recommend all these slightly better quality diets is because these diets tend to have what's called a closed recipe. So a lot of diets, the proteins in them, although it might say chicken on the side, actually there's a few, not all the protein that is in that food is just chicken. There might be other stuff that's thrown in there with it as well. And so we find that by feeding the higher quality diets, it's generally one quality source of protein, and it doesn't tend to change as sort of market prices fluctuate. So skin's really, really complicated. And what I would always say to anybody who has a skin case, like the question that we just had there about Jack Russell with anal gland issues, chewing feet and ear problems, is to prepare yourself for a little bit of a long haul sometimes. It's really important to speak to your vet and say, right, what's the plan? What happens if, we treat for mites with, I don't know, series of ivermectin injections or Milbamax tablets, or we give them, I don't know, Alidex baths, whatever it might be. So Bravecto, NexGard, that sort of thing. If that doesn't work, what's the next plan? Because it's like we're playing a game of 20 questions. So we give, say, NexGard or Bravecto tablets, which knock out mites and fleas, and we can say, right, well, if they're still itchy, probably not that. There's something else going on here. They're still infected at this point. Okay, well, let's put them on a 2-week course of antibiotics for deep pyoderma, deep infection within the skin. Okay, they're no better after that. Probably something else. But you know what? We can then be sure that mites and infections and fleas aren't then interfering with any results of any allergy tests that we might decide to do. So then the allergy test might be, okay, let's put them on a hypoallergenic dietary trial for 6 weeks. If we remove all the common allergens from their diet, do they get any better? Well, if they do, brilliant. Then it's something in the diet that's causing it. If they don't get any better, then we've already removed fleas, and we've already removed mites, and we've already removed infection, and we know it's not the diet, so it's probably something in the environment. Is there like a grass tree pollen, or is there a grass or something like that? And we can do intradermal skin testing and blood testing and all this sort of thing to try and get to the bottom of that. But the key thing is we had to go through those stages to get to that point. So it's a very systematic process, and I think you really need to have a really, really strong plan. And it needs to be agreed with your vet as well, because if at the end of it, we've all had older dogs who are 13, 14, and they've developed itching, and perhaps just papering over the cracks is the right answer for them, whereas in a puppy it's the other way around. So there you go. It's a complicated topic, lots to talk about. Okay. There is a question on there from Lynn. Hello, Lynn. Hope you're still here at the moment. My dog has a hygroma on his elbow. It's the size of a grapefruit. He's a St. Bernard. My vet doesn't want to operate. Aspirating doesn't work. Do I have any suggestions, please? Well, I can't comment on cases that are under the care of another vet. I'd say, Lynn, really important to talk to them and say, what are your ambitions for this? Do you just want it gone? If you want it gone, how much you're prepared to pay, how much risk are you prepared to take. I don't know how old your dog is. I don't know if he's got any other side effects or all that sort of thing. He's got any other illnesses, what the side effects of the operation or any medication might be for him specifically. So it's really important that these are taken on a case-by-case basis. Well, what I can say about hygromas, and hygromas, for those of you who don't know, are large fluid-filled lumps which we often find over points of contact, so the edge of the elbow, the edge of the tarsus. So I'm not going to get my foot up by the ankle. So the bits that the dogs kind of collapse down onto and lie on, and they're continually getting traumatized, and you can end up with these like I say, fluid filled lumps at these areas. They are continually traumatized, unfortunately, and as Lynn says, just sucking the fluid out, quite often that fluid will just build back up again. You can try to reduce the trauma. Now, one of the ways that you can do that, because the fluid is essentially a response of the body to trauma at the area. So where the bone has kind of contacted with the hard surface, the body is producing fluid in that area to try and cushion that. So what could we do to cushion that impact? Well, one of the simple things that you could do is try and get some weight off your dog. So, larger, heavier dogs, and in your case, to be honest, Lynn, with a Saint Bernard, there's only a certain amount you can do. But if your dog is really overweight, you can look to try and reduce the energetic impact of them going down by getting the weight off them. The other thing that you could do is consider what kind of bedding that you're using. Is it genuinely cushioned? When they lie in it, does it genuinely give at that area to make sure the pressure is distributed over the whole area rather than focused in one particular point? Dogs which like to lie on the floor, on the kitchen floor, especially large dogs because they're trying to keep cool, they can really suffer with this. So, maybe consider one of those cool mats or something like that, one of these memory foam beds, something that really cushions it all. Ultimately, the only solution to hygromas is surgical removal. There's nothing that you can inject into them. There's no cream really that you can rub on them. The only thing that you can do is cut them out. Now the problem comes that they are generally over joints, and these animals that have them are generally slightly older. They're slightly bigger dogs, which entails more operative risk, and so the likelihood of the wound breaking down afterwards is much higher than in most of the procedures. The other thing is that when we take a lump out, we tend to take quite a bit of skin as well, and that can leave a bit of tension at the area. So they are tricky procedures, and they're not one to be undertaken lightly, and I'm glad to see that you and your vet are having a conversation about it. But yes, they are difficult things. Can you just leave them? Well, I suppose you can just leave them if they're not causing a problem. What we tend to find though is that because the skin over them gets stretched and gets kind of thin, then that can cause issues with ulceration at the site. And once you've got an ulcer, then it's a whole different ball game. You're looking at infection, possible leading to sepsis, that sort of thing, and operations then become much harder as well. So yeah, hygromas can be complicated sometimes. Lots of dogs out there with them, and they're just managed on a day-to-day basis. Hope that helps, Lynn. Oh, look, I've got more questions. I didn't realise it was scrolling down there without me. Hello, Nina. Oh, look, you see, that's how far off I am at the moment. Hello, Justine, Vicky. Gosh, lots of people here. Tula licks her paws a lot. Is that normal? No sores or dry skin? Can be. It can be sort of a normal behavioural thing. It's a bit like chewing nails sometimes. So it's like that stereotypical behaviour. The stereotypical. I mean, it's sort of a boredom avoidance thing. They chew their nails, and as a result, they get a little endorphin hit from it. Yeah, it's sorry, I'm just going to resize my window here so I can see the questions as they scroll through. There we go. That's better. Excellent. So when they chew their nails, they do get an endorphin hit from it. When they chew their feet, they get an endorphin hit from it. It can be a sign of irritation at the site. So if they've got itchy pads, itchy paws for allergies, that sort of thing. If they've got any kind of pain, it can often be displacement behaviour, or actually locally trying to relieve a pain, just like you'd go, ooh, ow, it's really sore. It could also be an issue with like obsessive compulsive disorders. So dogs which are really nervous can get involved with this kind of behaviour sometimes. What I would say is that licking to this might this goes against everything everybody ever says. Licking never helps anything. It really doesn't. It makes an area wet, it makes it irritated, it slows down healing, it doesn't clean anything at all, it just makes things worse. So licking, driven to excess, will always cause problems. They can end up with acral lick granulomas. So people who've had German Shepherds will be able to tell you that sometimes on the back of their paws they can end up with really thickened sort of patches where the dog's just been kind of licking away there, and they're an absolute nightmare to deal with. So yeah, if they are licking, just make sure there's no obvious cause. If there's no physical cause, then start to think about, could there be a medical issue here? There you go. Lynn, so getting back to vet said leave it and it will go away. He's 2.5 and fit. That's great. Excellent. I'm glad to hear that. So yeah, well, let us know how you get on with that. Lynn, I've seen those leg supports. Do they work for hygromas? Any kind of these splints and all this sort of thing, I don't really like them, to be honest. They tend to cause irritation at other sites. If you ever, what was that butler called? Was he a butler? No, the servant in Downton Abbey, and he had a gammy leg. Mr. something or other. He was married to the girl from Coronation Street. Anyway, he had a bad leg, and he ended up, getting some kind of splint for it, and he ended up with sores. So yeah, that's slight deviation there. So yeah, okie dokie. So we don't have another question on the comments there at the moment. It is the middle of the day, and people are working, I guess. Let's see what else we've got here. I've got a question here about wood for dogs to use as chew toys. There are some chew toys that dogs would use them to chew, and they don't splinter. However, they do. Yeah, I think most wood does splinter. I don't have a particular problem with dogs chewing wood. Actually, it's usually not too much of an issue. I mean, if they overdo it, then they can end up with ingesting quite a lot, and that can cause GI issues. With regards to chew toys made out of wood, I don't know. I think you're kind of encouraging a possibly bad habit there, really. So I wouldn't do it. No, I just use some kind of inert rubber. That's what I tend to prefer, so to speak. Okay. Is there anything else on here at the moment? No other questions there. Well, I've got a few other questions there, but it's nothing too interesting. So, anybody got any other questions to mind that they want to bring to the session? We've been going for 20 minutes now. Hello, Louise, and Lisa, and Debbie, and Lee. Gosh, and Mel. Lots of people there. Hello, Claire. Hope you're doing well. So yes, just gonna hang around, see if you want to call in, feel free to give me a call on Facebook Messenger. I know it sounds a bit weird, but it's really not that scary. It's absolutely fine. There we go. I'm just going to have a quick look through my emails here and see if there's anything there that I've missed at the moment. I've got some really complicated questions that people have asked me, which I'll probably leave till another day. Oh, cats scratching on stairs. Sorry, I've missed that somehow. Thanks, Beth. Hi Beth. Any advice for cats scratching on stairs? Beth, is that the kind of paddy paws? Is that what they're doing at the moment? That sort of just, or is it proper kind of thing that you're seeing there? Sorry, there's probably a slight lag as well on this video. I'm just waiting for Beth to come back to me on that, because the two different scratches are quite important. This sort of paddy paws that we see is as a result of being kittens, and they tend to do that to get milk to come down. So when they're doing it on you, it's like saying, "Oh, hello, mum." You know, it's a very relaxing thing for them. That sort of more scratch, 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 scratch is normal cat behaviour. A lot of people think it's to sharpen claws, and there's probably an element of, you know, just wearing claws down, and they like the feeling of it. But there are scent glands in their feet as well, and so when they do that, it is part of their scent marking behaviour patterns, because cats are intensely territorial, and so that scent marking is really, really important to them. Why did they do it on your stairs? Probably because they tend to pick certain areas to do it. So think of these when dogs pee somewhere, or cats pee somewhere, or cats scratch somewhere. These are very specific areas that they go to. It's not random. In their brain, they've decided that that is a critical place to go to spread their scent and to improve their territory. So yeah, really, I would say the area that they're doing at, you need to shut them off from it. You need to break that habit. You need to give them alternatives, and something like a cat scratch post or something like that is one clear alternative. I'd put it near to that area, let them scratch on it, get used to it, and then slowly start to move it to wherever you want that cat scratch post to be. But and as I always say, you need to clean the area where they've been scratching with enzymatic cleaner that will break down any pheromones, that sort of thing that are in the carpet there. Hope that helps. Right, well, I'd better get back to work. It's been lovely chatting to everybody as per usual, and I'll try and do these a little bit more regularly because I quite enjoy them. Hope you guys do too and find them useful. Nobody's called in this time, so this is all kind of pointless, but hopefully at some point in the future someone will do. So get thinking, got any questions? I'll try and do this every week, and perhaps I should put up a notification rather than just randomly doing it like this. Have a lovely Wednesday, everybody. Bye.